You all ready?
Yes.
Sure.
Okay. So, the thing about high blood pressure, I'm just going to get right into it, all right? That one here. First, foremost thing is acceptance. Acceptance that the reason why you have high blood pressure is nobody's fault except your own. Okay? It's if you start blaming your genes, your race, your age, right, any other factor outside of you, you're never going to get over it. Okay? I mean, you're never going to be able to heal it. Is acceptance, okay? And I could break down every single, say, well, it's my age. Okay, well then why doesn't everybody your age have high blood pressure, right? It's your race. Well, why doesn't everybody your race have high blood pressure? It's your genes. All right, well, why doesn't every single person in your family then, right, that has the same genetic DNA have high blood pressure, right? Now, could all of those things make a person more susceptible? Sure, right? But it's not like, because of this, therefore that's why I have it. So you have to accept that you have done it to yourself, okay? And if you can accept responsibility for it, well then great. Guess what? Then that's something that we can then take the proper actions on to begin to change it, okay? Now the crazy part is, and I love doing seminars because it always gives me a chance to get really sharp on topics that affect a lot of people, right? And that we now know that just in the United States alone, a couple of years ago, it was 50 million people that have high blood pressure, but within a few short years, it went up to 75 million, okay? So it spiked. Now there's a couple reasons for that. Number one is what is going on with the current recommendations as to what should be your normal range, right? What keeps happening in those recommendations? They're getting lower and lower and lower, right? Well, obviously you keep lowering the numbers, right? You can fit and smush more people into a category, right? And so then therefore what can you sell more of? Pharmaceuticals, right? Because even, let me remember what year it was. I want to say it's about 30 years ago, if I remember right. Actually, you were not considered to have high blood pressure unless you were 160 over 100. Okay? Now, then they changed it to 140 over 90, right? The interesting part is when they made that change and they began treating it, they found zero statistical significant drop in death related to having high blood pressure, like strokes, right, cardiovascular events. So there was a zero statistical change as far as people living longer just by making that drop right there. Isn't that crazy, right? But obviously the amount of people that were taking the medications went way up. Now even more heartbreaking, and this is that 3% of kids now have high blood pressure and 16% have or really the technical term, right, is hypertension. Okay? So we're looking at about 1 out of 20-ish have already high blood pressure, right? And this is about 1 out of 8 have pre-high blood pressure. Okay? So again, we can't, just even that right there and understanding this, we can say, well, really it's not age, because then why the heck this is the fastest growing sector of people that are needing, well, attention, to this whole factor right here, okay? So literally go from here to here, there was zero benefit in doing so as far as living longer. And of course, this is why we get sold on this, right? Is that when you get put on or recommended high blood pressure medication, and by the way, especially since I'm recording this, I'm not just saying, watch this and then just go throw away all your blood pressure medication, right? Obviously, we gotta be smart about this, but usually when you go to a doctor's office and you get tested and you have high blood pressure, right? It's rarely, at least from what I hear from patients, right, is that it's rarely like, oh, let's say you're 160 over 100. Oh, probably be a good idea, if you start taking this blood pressure medication. I'll leave it up to you. I'll fill the prescription, but do with it what you want. That's not how it happens, right? What do they tell you? And if you don't, what will happen?
You get a stroke.
Yeah, you'll most likely have a stroke or die, or whatever scare kind of tactics with that. Now, are there some reasons to, if this was your blood pressure higher, be concerned about it, and maybe it would be life-threatening? Absolutely, and I'm not saying that. However, but even we know people that are more in this category. I've seen people that were told they should be on high blood pressure medication because they were 130 over 90, right, or even 85, because of some blah 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 reason, right? And so we have to understand, again, and this is not to paint doctors or your primary healthcare providers into like a corner that they're wrong or they're bad people or anything, but unfortunately just the science does not, the actual data does not really back up a lot of the statements that they make, such as stuff like that right there, okay? Now, primary cause. Now there are going to be multiple, but the primary cause, and this is going to blow your mind, okay, when I explain this, because it blew my mind when I first actually started picking this apart, but it's, without question, it's inflammation, okay? Now remember, again, part of this is I want you guys to understand this and how this happens, because we oftentimes feel like, or we can be sort of sold that because we have high blood pressure, it's almost like as if, and this could be any condition, right, is that it's our body is betraying us to some degree, right? You could maybe substitute betray for a synonym, but it's like, oh, like, well, things are starting to fall apart, or, oh, this is not good. Versus if we really understand the physiology or the mechanisms as to why your body, which knows exactly what to do at the right time for the right reason, when it's creating a scenario like this, that it's actually doing the best that it possibly can for you with what's going on. And I'll explain this, okay? Now, in general, all right, when there's inflammation going on in your body, all right, is that going to cause something to shrink or to like swell if you have inflammation? If you sprain an ankle, does it get smaller or bigger? Bigger. It gets bigger, okay, right? So if you have inflammation, right, present in your cardiovascular system, all right, let's break that down a little bit, right? So cardiovascular system is going to be heart, all right, and then you're going to have arteries, right, and veins, and then even down to smaller, you're going to get down to capillaries, right? So it really can occur in any one of these, or really it's usually all of it if it's in one or the other, okay? So if we look at, this was an artery, okay, or a capillary, right? So we're looking at a cross-sectional view, right? Basically, it's a hose, right? It's a very specially designed, created hose, right, with a lot of very, very cool things that it can do. But that's essentially what it is, right? So blood is going to be passing through here. White blood cells, right? All the healing factors, every iron, heme, everything is flowing right through here. So if there is inflammation occurring in your cardiovascular system, and by the way, this right here, okay, would be like a muscular wall, right? That's kind of like helps to push the blood, helps plump, the heart does the majority of the pumping, right? But these things kind of, they have the ability to expand and contract, right? If you're beginning to exercise, or if you're starting for a jog or for a run, these are going to dilate, meaning they're going to open up to allow more blood flow, right? Be able to get it from your heart, to your lungs or to your muscles, whatever it is. Or if there's certain circumstances where they would actually constrict or contract, right? Depending on the scenario of their environment. But if these become inflamed, right, and not just like acutely, but we're talking about chronic, I guess we should put chronic inflammation up here, right? Then what happens is that this tissue begins to get damaged, right? And as it gets damaged, it is going to create scarring and even swelling, right? And they've done this through, specialized scoping and imaging on, at the microscopic level even, okay? So, if this is now a representative of the majority of the blood vessels inside of your body, right? Well, this one or this one, which one do you think is going to be able to have more blood pass through that? Obviously, right? Number 2, okay, every single time versus number 1. What happens is when it becomes scarred there, not only do they constrict and narrow down, but they do not have the ability to dilate or open up, right? It's like, when you have scar, you know, like let's say if you get a cut and it turns into like scar tissue, right? It never is like the same stretchiness, right? It doesn't look the same. It's the same thing on the inside, all right? So now, this blood, this vessel here, right? Let's say that's going to, I don't know, a vital organ like your lungs or your liver. It doesn't matter. It can be any part of the body, okay? Now, just because you have a drop, you have inflammation and scarring going on in your blood vessels, restricting flow, does your body, do these organs or your muscles, right, do they automatically drop their demand in what they need from the blood supply? No, they're going to have the same amount, right? So again, here's where this is key. Remember, this is all, you know, we have your brain, right, talking to your muscles. This is all a back and forth communication. It's not a one-way street. It's not a dictatorship in the body. It's a partnership, right? And so let's say you start exercising or go for a walk. And this might be just walking to your car, right? Or you get up in the morning and it's like now all of a sudden like things are starting to like pump and move differently. Or, you know, your stomach, right? You're eating food and so blood flow's got to get there to help do what it needs to do. So there is going to be then a signal essentially, and you guys get that I'm like way oversimplifying this, right? But it doesn't matter. Signal to the brain, I need more blood. Blood is talking to the heart, right? So the only way, if there's constriction going on, right, we can think about this in a hose in your garden, right? If it's getting less blood flow, right, the only way where we could see a scenario then where there could be the same amount or close to the same amount of blood flow that would get to these organs would be to do what?
Hard to pump.
Push harder, push stronger, right? Aha. So now let's reverse engineer that. Now, said scenario is going on. Blood pressure is going up. Why? Because it's doing that to continue to attempt to meet the demands of what your body needs, right? So now we bring in a pharmaceutical, right? Because we have high blood pressure. Now blood pressure, heart pumps down. There's different types of blood pressure medications, right? There's about 5 different ones. Some work on helping you, like a diuretic to get rid of fluid. Some are beta blockers, which actually physically tell the heart not to pump as hard, blocks the muscle contractions. And again, I'm oversimplifying the mechanisms of those. But all that being said, some are angiotensin blockers and tensinogen blockers. And if you think about tension, tensile, right? They block the ability for the arteries to contract and constrict, so they kind of can forcibly open them up a little bit, right? But all at the end of the day, now if you're going in and you're physically dropping blood pressure down or the heart's ability to pump that blood harder, then what's going to start happening to all those things at the end of those vessels? They're going to suffer, right? And so if we look at the side effects that go on with blood pressure medications, they can kind of begin to make sense then, right? If you're not getting enough blood into your muscles, well then it makes sense that one of the most common side effects of blood pressure medication would be low energy or lack of energy, right? It's a big one for men is loss of libido, or like inability to have an erection, right? Because again, if it can't get blood in there, because it's not be able to pump as hard, well then you can see what that happens. Get lightheaded and get dizzy, right? Well, if you can't get enough blood up into your brain, then you stand up too quickly, maybe, right? And it's like you get woozy for a second because your body's not able to get that blood. Normally, if you stand up, right, your heart can shoot and launch, and it will launch a bunch of blood up into your brain to make sure you don't get all lightheaded and dizzy there. It doesn't happen. Headaches, right? But now even, we're finding the longer we use things, so we're talking about like 10 plus years, this is where more severe diagnoses happen, like things like cancer. Found that women 10 plus years have taken, I believe it was beta blockers, increase the risk of cancer by about 40%. Other ones are depression. So you think about not getting enough blood flow into your brain as it's needed, there's going to be issues, right? And then another one, diabetes, okay? So, those are just some of them, okay? So now, I just simplified like what 75 million Americans have, right? Right, in just one little picture here, but you gotta just get the basic fundamental mechanisms down and understand why, most likely, right, your body is experiencing high blood pressure in the first place, but then secondly, to kind of figure out, well, that makes sense. Shortness of breath, right? If the lungs aren't getting it, that's another common one for that happening. Now, it's not necessarily, also it kind of, and I put this from kind of like a medical perspective here. Number one great resource that I would recommend if you have this, and this is also for people that are watching this here, a great resource is a book by Dr. Jack Wolfson. He calls himself the paleocardiologist. And that's Dr. Jack Wolfson, by the way. He's a DO, board certified in cardiology. He ran one of the largest cardiology groups in the Southwest. Just crazy. But what happened was that he got sick of just giving people drugs and referring people to surgery because he found out he saw the same people for the same thing over and over and over again. And then he ended up marrying a chiropractor. That really kind of cemented his shift into what he was doing for that. Okay, do you need something? Oh, you're racing behind us. Thank you. Yeah. I didn't know what was going on back there. No, thank you. That saves me time. Yeah, in case I need to do it. But so he really unpacked it. So these are going to be additional lab tests that, and doing some research that I saw that he recommended because it's to help really identify mostly your level of seriousness of your blood pressure, if that makes sense, not just your symptoms. So here were some labs that he recommended, and I was familiar with all of them, I just didn't always necessarily know the context for them. So some labs and some tests to request from your doctor to really get a better idea of causation of going on, okay? So labs, one of them is going to be something called ProBNP, and that's brain natriuretic peptide. And what this does is it measures the true amount of stress that your heart is undergoing, okay? So obviously if this is significantly elevated, it's starting to go deeper than just the fact that you have high blood pressure. It's that it's beginning to cause wear and tear in your heart, okay? Another one is called galectin 3, and what this measure is tissue changes occurring in your heart, specifically something called fibrosis. Okay, so fibrosis would be like a thickening or a hardening of the heart tissue, right? Which of course long term is not going to be good. Another one to be doing regularly is a urine analysis, okay? And what you'd be looking in for that to see if there's something called proteinuria or protein in your urine, okay? So if there's protein spilling out through your kidneys right into your urine, that's really a measure of like how long-standing, all right, and severe the damage is to. And again, we're not just talking about the fact like, oh, like I was diagnosed with high blood pressure in 1988 or whatever, right? We're really talking about how long has the blood pressure or your cardiovascular system been under a severe amount of distress, right? And then another one, which is really critical in multiple areas, but fits into this too, is C-reactive protein, which is a direct inflammatory marker, all right, for primarily the cardiovascular system, but really the body in general. So CRP, and just to give you an idea of like how really low hanging, like I know for example, it costs between like $5 and $6 to get CRP run, you know what I mean? But really, just knowing this, it can show you if you're twice to up to 4 times as likely as having a heart attack just by what that marker shows you right there. So it's very well established. It's not like some kind of theory, you know, lab marker. It's like this has been studied left, right, and center. So these are ones. Now, along with that, you know, doing some, like for testing, like getting an echocardiogram, right? An EKG of the heart, right? And a lot of this is really to measure, is there thickening happening, and especially in the left ventricle, right? Which is, if that is getting ventricular hypertrophy, I might be using some terms you guys have at least heard of a little bit. That means it's getting bigger. Hypertrophy means growth, it's getting bigger. And if that's getting bigger, right, unfortunately, so like obviously the more you use a muscle, right, it's gonna get bigger. Well, unfortunately, if your heart's beginning to enlarge, that's not a good sign, okay? Because it's more likely to fail and have tissue damage at that point. Also doing an EKG, okay? Like I said, yeah, you know, right, which would be like, you've seen that before, and it's like the little blips, right, and the little thing right there. Again, a properly trained cardiologist is going to look at this here and not just say, oh, you have heart abnormalities, right? But really help you identify, you know, where is it going on, you know, because also it's very common that you'd see some arrhythmias, all right? Start occurring with long-standing blood pressure, right? Maybe a fibrillation, or, you know, there might be, this is fun for me a little bit, because we did have cardiology training in chiropractic schools, one class. And it was like, oh, like my brain's hurting, trying to remember all that stuff. Like there's the P waves and all this kind of stuff here. And, you know, anyways, it was good to kind of go back and through some of the stuff here too. But the point is that it shouldn't be a big ask to get this to be really thoroughly interpreted for you, okay, when you get it done, all right? And, or at least because don't bring it to me, because you know, you don't want me diagnosing this stuff, okay? I'd be like Google imaging and not know if I'm on the right spot there. But the point is at least identify and get, like, what if this is going abnormal, then, well, then what's the actual diagnosis, okay, of what's going on in my heart? Because then it's like we can start looking at the physiology, or what's the mechanism, right? Because unfortunately, I might get in trouble for saying this, right? We used to have a joke in chiropractic school, all right? That MD stands for more drugs, right? And DC, right, stands for doctor of cause, right? So we used to have fun saying that, you know, more drugs, or mass doping would be another way of saying it, right? Okay. That was just our little chiropractic brother and sisterhood joke that we would have for there too. But again, it's just really important to, I'm laying the foundation here, I guess, right before we even get into what do we do about it, to know what is actually going on inside of my body. For you saying I have high blood pressure, and I'm saying you as like their doctor telling you that, that's like saying to someone, oh, you're gonna die. Well, okay, how, when, what, you know what I mean? Like it's a very vague, you know, an ominous vague statement that doesn't really help a lot, other than the fact that that just gives them the ability to go, here you go, just take this, right? And again, I'm not throwing it under the bus, I'm just saying that having this diagnosis of high blood pressure then ultimately becomes your responsibility then of like, okay, what can I do on my place to investigate this and seek answers, right? Again, so it's just kind of giving you tools as the patient, right, to help you sort of kind of dig in as deeply as you possibly can on your own, all right? So like, let's go through then now the causes. Thank you, Jen. Of the most common causes anyway. So, you know, again, we talked about inflammation, but some really, really, really important ones too, okay, would be lack of sleep. Huge. I know I posted this on Facebook. Not all of you, you know, maybe follow me on Facebook or have seen that, but women that got less than 6 hours of sleep were 8 times more likely to have a stroke, right? Which is crazy. Less than 6 hours of sleep a night, were 8 times more likely to have a stroke. Even 7 hours, right, they were, I think, 2-3 times more likely to have a stroke there too. So target is 7 to 8 hours, okay, minimum of sleep. And you should be as close to, harder this time of year, harder in our society, right? But our ancestors would have wound down when the sun went down, and wound up when the sun came up, right? So now the sun's going down at 6 o'clock, and a lot of us, like, you're not even home from work at that point, right? So that's not really realistic, but it should at least be on your radar that that's happening, okay? So, you know, I would say that you should be we call them solid yellow lines, right? This is one of my favorite principles. Like, if you're driving and you see solid yellow lines, what does that mean?
Caution.
Do not pass, right? Like, if you're here as a car, like, going here is gonna be risky for you, right? If you see a dotted yellow line, you know, use at your own caution, right? But if it's a solid yellow line, it means you do not cross, right? So there are things in your life that should be solid yellow lined, right? Like maybe work, you know, it's probably a good idea to solid. I think I should maybe go to work, maybe not go to work, right? With that. Maybe some spiritual time, right? So the point of this, what this means is, unless the sky is falling or only massive crisis, right, pulls you off the solid yellow lines. Now, dotted yellow lines here, right? Something like that might be, I don't know, your favorite TV show. I'm just giving examples, right? It's like, hey, I would like to watch this, right? But if there's something that is a higher priority, like, well, then it's easy to kind of swap in and swap out, right? So but what I'm saying is you should be solid yellow lining sleep from at least, I think it's realistic, from 10 to 6, right? And this doesn't mean your eyes have to be closed, but like you are in the sanctuary of like your bedroom, no technology. If you want to read a little bit, you know, in that window, I think that's fine or acceptable, but like this should be blocked off time as much as possible, okay? Some people, you know, you might have to do 11 to 7. You get the idea, right? It could be 9 to 5, okay? So you're looking for roughly at least an 8-hour window of like, this is my time, my body's time. Because there's consequences to this. High blood pressure, less insulin sensitivity, right? So insulin resistance. We were meant to sleep, right? Or there's major issues. Caffeine is another big one. Some are way more sensitive to it than others, okay? And one of the biggest things is that caffeine is a vasoconstrictor, okay? Which means that it narrows down arteries and capillaries, okay? So if you want to really know how much this affects you, then what you'd want to establish is, you know, take a blood pressure reading before a cup of coffee, right? Don't eat anything else, don't do anything else, right? Drink a cup of coffee, and then like take your blood pressure for like every 15 minutes for like an hour afterwards and see what it does. If it goes up, I would say more than 10 points, then you know you're definitely sensitive and there's issues with that, okay? So, again, listen, I'm a big coffee. If I got if I got these news, I would be pretty devastated, you know what I mean? So what you could easily maybe look at doing something like a half calf, you know, half decaf type, you know, maybe like a scoop of each in your coffee pot, whatever, and just at least bring it down some, right? Or obviously try to switch to a decaf, you know, option there too. Again, this may be, you know, the only way to know is to test, all right? So like, don't just cut out coffee because you think what it is, like know what it is for sure, otherwise don't, okay? Because there's a lot of good benefits in coffee. Oh, and by the way, for this, of course, it needs to be organic. That would be probably your first step, even before switching to decaf, would be to change to organic. The pesticides and herbicides that are used to process coffee are just astronomical. I read somewhere, and I couldn't find it again, but I remember reading it. I remember I was on my phone, so I couldn't save it in the moment. And anyways, there's as much pesticide content in 1 cup of coffee than a person would get in like eating a whole week's worth of like just conventional fruits and vegetables, right? So it's that high is the point, okay? So organic coffee, spend the extra couple, you know, bucks a bag, right? It doesn't have to be that expensive. You can buy the like, you know, hipster coffee for really expensive, but you can get big things of organic coffee at like Costco for really not that expensive, okay? So that would be a good switch right there. Now salt, all right? Now salt is another one. Now the reason why I say that, you think almost like presumably like, oh, of course you should cut out salt. Not everybody. It's only some people are going to be what's called salt sensitive. In fact, for some of you, you actually may have poor health because you're inadvertently or mistakenly avoiding salt, okay? So again, the test don't guess right here, right? So what you would do is just put some salt in water. I would say like half a teaspoon, drink it, right? Check your blood pressure. Does it go up? If it doesn't go up, then you absolutely 1,000,000% should be making sure you're getting salt on a regular basis. Now here's what's really cool. Actually, at least I think this is cool. Now, typically African Americans, okay, are going to be more sensitive to salt. So if you are not African American, you are likely not sensitive to salt. And here's what's interesting. The theory of this is, and I say theory because of course nobody really knows, but the theory is that during the horrific part of our history, right, with the slave trade and everything, they found that, or the theory was that the majority of the people that were being brought from Africa would survive the trek and the voyage was because they had an ability to actually retain water better, okay, right, versus dying of dehydration, right? And so because of that, then now as we're here, African Americans, right, you would have a population of people that would have that. It's a genetic trait is essentially what they're theorizing, right, to retain that water better through salt, okay? So then you think that basically anybody born in America that have African ancestral heritage likely has, not all of them, but a large percentage would have that genetic trait, so meaning more sensitive to salt. And it's true is that there are more African Americans per capita that have high blood pressure than any other ethnic group. And again, that's why they think the theory of, isn't that interesting? I think that's really interesting, right, for that. So, so again, if you're African American or black, you're likely more salt sensitive, but again, not guaranteed, right? So again, the only way to know is to test, not guess. So again, I would say that seeing a rise greater than 10 points on, either your top or your bottom number an hour after taking this would likely mean that you're salt sensitive. Now, I wouldn't mean you don't take any salt whatsoever because you do need salt, but then you just need to be very calculated with your dosage, right? So I would, make sure that you're getting still salt on a regular basis. I would just do a lot smaller doses at a time, okay? And remember too, we're talking about like sea salt or real salt here. There's a big difference between salt and sodium, okay? Salt is technically NaCl plus a whole bunch of other minerals. Sodium is just Na plus, okay? Sodium really, especially in packaged foods, would be the main thing to avoid. You're not just trying to avoid pure salt, okay? 100%, right? Because your body's going to suffer by not getting that at all. Chronic pain is another one that will up blood pressure. Your body perceives that as stress, and this is one of many reasons why. And I knew this without even reading the research because I see it all the time, but one of many reasons why chiropractic patients can see a mild to moderate reduction in their blood pressure just by getting adjusted, because if you're in less pain, well then your body's under less stress, and if it's under less stress, less fight or flight, right, there's going to be a decrease in blood pressure. Another one is heavy metals, specifically lead. All right, a couple of generations ago, really only one generation down for me, two, I guess, upwards. Lead was a big part, unfortunately, of our environment, right? Lead paints, right? That was the upgrade from what I understand. Leaded gas, cheap toys that started coming over that made out of lead, right? Because it's really, and the issue too with this is that lead can pass anywhere from 4 to 7 generations down. Okay, so meaning that great great-grandmother, if she had been exposed, right, it really could have gone all the way down to you just because of what that exposure was up there, okay? And it does pass through the placenta. So, and then you think about the fact that where it kind of could potentially be bioaccumulating as it goes down certain generations with that, you know, too. And so, lead's a pretty simple, it's a pretty easy way to test. It's about $100. It's a very specific urine test, not a blood test, okay? Another one is what is kind of collectively called EMFs, all right, or EMPs, which stands for electromagnetic frequencies or electromagnetic pollution, okay? Really, you know, since like the 90s, right, has this really only been a problem, okay? So we're talking about, I mean, even the fact that, you know, we're in this room right now, we're bathing in, Wi-Fi, right? Cell signals now, there's these 5G high vibrational frequencies.
So using the phone,
you know, every time you're watching, you know, every electronic device, hardwiring, electric, you know, is running through there. They're all generating a certain level of energy and frequency that is obviously not biological, right? And so we're finding now, again, some people are more sensitive than others, you know, to this. So here's what I would just say would be some really easy things to change, like right away. Turning your Wi-Fi off at night before you go to bed, okay? Either unplug your router, or I know like from Best Buy or Amazon, you can buy little plugins that with an app, actually, you can set a timer on it. So like it'll automatically kick off at a certain time and then it'll kick on at a certain time. I actually have my router in a what's called a Faraday cage. So it's got like an aluminum or some kind of metal box over it that essentially blocks a lot of the like just kind of weird directed thing there. But shutting it off, putting your phone on, you know, airplane mode or off, like whenever you're not using it, of course, especially at nighttime, right? And so making sure it's on airplane mode and quite a ways away from too. So there's devices now that can measure these things. Mine ran out of batteries. I was gonna bring it tonight just to show a quick demonstration, but the thing ran out of battery. I didn't have time. I didn't realize it was out of batteries. I didn't have time to get it. But I was literally holding up with my phone, and it's like every time I would get a text or like you could tell there was a data push of some kind, you could see the little thing ping, ping, it would like just shoot off the charts for that. So, you know, if you're talking on the phone, holding it away from your body as much as possible. Texting, believe it or not, is actually better than talking, right? As far as because it doesn't send as much of a strong of a signal. Bluetooth, like ear things are also not good. So actually having a hardwired headset is better. Okay, so you know, I know you don't really get. I think you get only like AirPods or whatever. I don't know for the phone, but like I still save. I'm like trying to collect as many of like the wired ones that people don't want because I'm like as they wear out. I'm like I need to have a supply of those right afterwards too. Making sure your TV is shut off at night, right? You know what I'm saying? So just kind of like take stock of your, especially the environments you're in the most, and figure out how could I reduce some of the like electromagnetic kind of what is called monkey business going on in my environment, because all of that puts stress on the body. I know this is a little bit wonky, but like it's true, right? And smart meters are another big one. So I would check this if you're, like if this is like the, you know, your bedroom, let's say this is your bed, you know, this is the outer wall of your house here. I would make sure there's like the smart meter is not on the other side of your head right there, because those things they used to do it where people would have to drive through your neighborhoods, the company, the technicians, and they would like kind of shoot a little signal to it and it would ping it and then it would send back like what your usage was. But now what they do is they're kind of communicating like cell phones, where it's like it's constantly, you know, like shooting from this smart meter to your neighbor's smart meter back to the hub. So it's kind of this constant like sending of it's crazy, right? And I do have a video on my Facebook where I went outside and I held up that meter to my smart meter, right? And you could just see it was just going like crazy. Gas meter's another one too. So just make sure that your head's not right there, okay? Because that would be a big issue too. Because you can get rid of them, but it's a pain in the butt. So at least try to get your head away from it as far as possible when you're sleeping. So I don't want to go into this too much because I plan on doing a whole talk on this at one point, but there's some low-hanging fruit there, right? Get the Wi-Fi off at night, watch your phone usage as far as, especially when you're sleeping, right? And just be careful with that. Of course, sugar, right? Big cause of inflammation. Big cause, okay. I'm not gonna go off on that one too much because, again, I've done 17 other million talks that. And plastics are another big one too.
You don't exaggerate.
No. Maybe 1,700, how about that? That actually is probably pretty close, right? For sure 170, I could at least hang my hat on that one.
We'll think you didn't do it very often. So.
Right, yeah. So plastics are another big one. So BPA and phthalates have actually been shown to elevate blood pressure. So, plastic bottles, drinking out of it, definitely don't store food in plastic, get glass, get Pyrex, okay? And another one too, which is a lot of, out of our control, right? But air pollution, which is crazy. So they actually found, there's a study that was done, air pollution it would increase blood pressure on average between 7 and 9 points. So, thankfully, here in Raleigh, we're not going to have as much as some other major metropolitan areas, right? But just, be aware of it, I guess. And if it's something that you might have more of a friend or a loved one that might be more susceptible to this, and there'd be some smart to at least do some type of filtration in their house, right? That would at least make sure it's not like getting into their house, because think about all your air gets sucked from the outside, right, and then brought into your house. So some filtration systems would be really key there. Okay, almost done here. Now we're going to go over some solutions on what we need to do.
Anything about water?
Nothing specific.
Okay.
Yeah. I mean, other than staying hydrated, right? But nothing specific on types of water and whatnot. So exercise, big one. I mean, it's bulletproof. There's not one study that shows that exercising makes your blood pressure worse, okay? And I think this is really key because I'm beginning to move actually away from this word. And I think what's really important is to really think of it more in terms of movement, okay? Because exercise has kind of become this sort of like stigma, right? And there could be all sorts of like stereotypes that might go along with that, but movement, getting your heart rate up specifically, right? And so that may involve anything that gets your heart rate up, I would say over 100 would be considered exercise. So a slow walk, I mean, it's good, but it's not really going to get your heart rate up over 100 unless you're really out of shape, and that might be where you need to start, and that's okay. Yoga actually is another very well-researched practice that shows that lowers blood pressure like 10 plus points just by itself, okay? So yoga is a great practice, and it didn't designate any major length of time. So I would interpret that probably as anything like 10 minutes plus, right? And you can, nice thing about that is you don't have to go someplace to do that yoga now. You can
YouTube it.
YouTube, exactly. Yep, and watch free classes. And it just, standing, moving, it's easy. Another very well-researched one too, massage therapy. Also will typically lower blood pressure between 5 to 7 to 10 points. So another reason why we're starting that here in our office, just, on the weekends, is that it's just a great way to, I think the mechanisms weren't laid out clear, but I would look at it as multiple. So A, it's gonna help with circulation, right? B, it would help with de-stressing the body, right? So you can see there'd be multiple ways why that would help. Now another one that was not really well, there was a lot of conflicting research on it, but it'd be acupuncture. So I would say, I think acupuncture is good kind of either way, but it may be a solution for some blood pressure relief, but it may not, okay? And it was, some said no, some said yes, right? Whereas this was like, definitively yes, right? Definitively yes. This was kind of a, we'll call it a in question, but might possibly work for you. Now another really, really exciting one, of course, Chiropractic. What you can do is Google this. You just put, whoops, not WebMD. You can put chiropractic, blood pressure. You know, literally on the WebMD website, you can read the study. Here's essentially the summary of the story, how the study came to be. This was a doctor in Illinois, chiropractor, was, I believe, friends with or associated with a doctor of hypertension. So all he dealt with was a researcher on hypertension. This is up in Illinois. And the chiropractor was like, hey, I'm consistently finding that when I adjust this area on patients, that I'm seeing they're reporting better blood pressure. And the MD was like, no way. And the guy, and essentially I think it kind of started as almost like a bet a little bit, but he had showed him some preliminary data, and the guy was like, okay, so they did a research study, and they actually found, so what they did was they did 3 groups. There was a group that got the adjustment, second group that got what they call like a sham adjustment, basically like a fake adjustment. It might be like a mimicking it, but like the patient wouldn't necessarily know that it was a real adjustment or not. And then the third group was, which is ultimately, this was the control, okay? Or there might actually have been 4, because there was a control that didn't do anything, and then the fourth one, sorry, was they got meds, okay? So went through the study, and I think it was 6 weeks. I forget the exact specifics on it, again, you can read it. But they found that when the study was over, the people that got adjusted, their blood pressure dropped on average 17 points for millimeters of Hg mercury pressure, okay? And that beats the meds. It was 2 times better than what the meds results were, and there are no side effects, right? And the specific bone was the atlas, okay, which is the very top bone in the neck right there. And really the neurology behind that, oversimplified, is that where your brain stem sits, which is the base of your brain, right? Your brain, and then it comes down to your brain stem. Within your brain stem, which is what the atlas protects, so it just encircles it, is the area that is responsible for like blood, heart control, heart function, right? So just by regulating that or helping improve that, it helps regulate. Now, would all people that have high blood pressure, you know, just by getting that bone adjusted, have their blood pressure drop? Not necessarily directly, right? But it'd be a good thing for people to check out. And again, I'm talking about kind of preaching to the choir here, but it'd be, you know, also people that are watching this too, is that to take a look at that and you know, see a chiropractor, potentially get that looked at. And either way, again, we could go back a few steps, and even if that's not something that they could treat or find, right? They're likely to reduce pain in your body. Obviously to increase function, lower inflammation, okay, too, so there'd be a great provider for you to help, you know, get that. Again, it doesn't mean it's solely on the chiropractor to get that blood pressure down, because you got to do your part, right? But it may be a missing piece to the puzzle, okay? So supplements, all right, and then we're gonna wind up here, or wind down. Some of the big ones, because there's really dozens, so I kind of picked what I think are probably really the best. Let's see, 1, 2, 3, 4, 5, 8 or so, okay? Allicin, which is garlic, which is found in garlic, okay? And so really when I say supplements, you know, technically you could just be taking garlic like a supplement, but you can find allicin in supplement form. Really, really, really easy raw supplement to get, because they just press it and get the oil, you know, out of there.
And about how many milligrams a day, or is it, it's going to depend on the person, I guess. But
yeah. I believe allicin goes in some kind of special kind of units. And for some reason, this might bite me in the butt, but I want to say it was like 20,000 of like garlic units there. What I would say is start with taking one, like recommended, you know, out of there, and go from there. You know, it's really like you can't really overdose on it, right? So you could sort of, if one maybe improves it a little bit, try 2 improves it more, then try 3 improves it a lot more, right? Then it might plateau at a certain point. Another one is things that increase nitric oxide. Now, one of the best foods to do this, now, although this is not one that we recommend per se, is beets actually. Okay, so beets are really, really good. They're high in nitric oxide. But what we can kind of get around, and the reason why I say that is because these are pretty high in sugar, okay? But the way you can get around that is that most of the supplements that are good food-based that increase nitric oxide would contain something like beet root powder, okay? So it'd just be the roots that are dehydrated down, okay, and then you would take that and increase. But what nitric oxide does is it dilates blood vessels, okay? So great. This is, and what's interesting to me, so it's funny, like this is what a lot of like bodybuilders, you know, people that like exercise really hard take as like a supplement, because if you know you work out and you want to get more blood flow in there, but it works, you know, uniformly through your body in that sense. Magnesium, great for blood pressure. That you're looking for about 600 milligrams a day. Now, not necessarily in supplement form, but that's like what your target is for consumption. Okay, so I usually recommend like between 200 and 400 supplemental, you know, a night. Usually it's the best to take at night. And that's been found to be like a 10-point drop. It can, 8 to 10-point drop. Sorry, 9 over 7, so 9 on the top, 7 on the bottom on average for doing that. Another huge one, huge, I posted about this one, is potassium. People think that about 50+% of Americans are deficient in magnesium. No way to know unless we test everybody, right? But estimates are that 90% of Americans are deficient in potassium. Okay? And the reason why this is so critical for blood pressure is this works a lot like sodium in the body, and it helps just create the proper action in your cells and just proper flow, for lack of a better term. And I posted this a couple days ago, and I don't know if anybody remembers exactly what it was because I have so many numbers in my head right now, but I believe that if in the world, if every single person got the amount of potassium, are you checking it, Oli, right now? Okay, I want to get the number for me on that. What you want to be getting is about 4 to 5 grams of potassium a day. And remember, don't just fall into the trap of, oh, just eat more bananas, right? It's potassium. Too much sugar. So there are lots of other foods. Sweet potatoes are high in potassium. Cucumbers, thank you. Zucchini, yep. Cukes. What was the number of the drop on there?
I don't see it.
Okay. It was a lot of people. It was like saving hundreds of thousands of lives per year just by everybody getting enough potassium. Okay, it has that big of an effect on blood pressure. Yep.
Increasing potassium intake alone would decrease the number of adults with high blood pressure by 70%.
17,
and increase life expectancy by 5 years for over 12 million Americans.
That's what it was, right? Isn't that crazy? Wow. 70%, so about 1 out of 8 roughly would be completely healed of their high blood pressure, right? So there's 8 of us in the room. We all got blood pressure. I mean, just by us taking up potassium, right? One of us would automatically not have high blood pressure anymore, okay? But then what was it? It was 12 million Americans would live 5 years longer. Crazy, okay? So huge. Another couple ones. One is taurine. That's around 6 grams a day. Taurine is a great natural antidiuretic, okay, or excuse me, diuretic, right? So by helping your kidneys get rid of that excess fluid, right? So like there's lots of medications that are diuretics, right? So there are natural ways to do that without putting that additional strain on your body, okay? And then other ones are L-arginine and citrulline together. And both of those operate very similarly to nitric oxide, and they're vasodilators. So these would be all kind of like, well, I mean, most of you know, right? Like magnesium is kind of a, should do it anyways. Potassium is now on my list of regulars, okay? And just reading how deficient we are, I didn't realize it was that big, so I now take potassium.
What's it say after taurine?
6 grams a day.
Grams.
Yep. That would be like the therapeutic dose for high blood pressure. And then some other ones that again are kind of like staples anyways, but also help with blood pressure would be CoQ10, vitamin C, and then like cod liver oil or omega-3s, okay? So these would all be one that, you know, should really be a part of like a regular kind of supplemental protocol anyways, but they do also have a nice effect on blood pressure. Vitamin C, we're talking like 250 milligrams minimum, all right? CoQ10, about 100 milligrams, 50 to 100, I should say. Cod liver oil, you know, 1 to 3 grams a day. And what omega-3s do a great job, so let me unpack this a little bit. Every single cell in your heart requires CoQ10 to basically pump it, which is crazy, because guess what? Statins block CoQ10 production. Go figure, right? Vitamin C is the precursor to collagen, which is what every single one of your blood vessels are made out of, right? And so the more you supply that, we're the only mammal that do not make vitamin C. So like my dogs, their bodies just, they generate vitamin C on their own. Monkeys, right, they all produce their own vitamin C. We're the only ones that don't, so we have to get it from external sources. And there was a guy by the name of Linus Pauling, all right, you can look him up, Linus Pauling. He was the father of orthomolecular medicine, which is basically a fancy way of saying using nutrition to treat conditions instead. This guy won Nobel Prizes, okay? Meaning like the top scientific awards in the world, right? For showing how critical things like vitamin C is for our health, right? For specifically cardiovascular health. So, and then what omega-3s do is they're really good natural blood thinners, okay? We're just keeping your blood from being too thick, right? And again, thinking about how that would help blood pressure, if your blood's thinner and it's not thicker, right, it doesn't have to pump as hard to get it where it needs to go, right? It's a lot easier to you know, for running water versus molasses in January, right? That's the phrase we use in the north, right? Slow as molasses in January, because it wouldn't move anywhere, right? It was kind of frozen there, thickening, okay? So when you look at this, I wouldn't say, oh, I need to take all this stuff, right? There's really would be kind of some rhyme and some reason for doing this. If it were me, just kind of starting off, I think some no-brainers, because they should be anyways, would be magnesium and potassium, right? Making sure we're getting enough of that. See how your blood pressure responds there. And then I would probably next add in the vasodilators like L-arginine, citrulline, and the nitric oxides, right? Taurine would be like probably the third tier there. Unless if you are prescribed or on a prescription for a diuretic, right, then you'd want to incorporate that right away. Does that make sense? Okay, like if you know that is one of your mechanisms of high blood pressure, then you could sort of start, and I'd say to be really careful and like work with your doctor on this, but and keep track of it. But you would be, right, just looking at, okay, if you're on a diuretic, you could start with some natural diuretics, right, and see how your body responds when you add that in. If it lowers your blood pressure down, you might be able to replace the diuretic portion of your medication pretty quickly, okay? If you have high blood pressure, you know, I think most people do probably, but a no-brainer would be to get, you can get them off Amazon, right? Get a BP cuff. Maybe checking yourself regularly, okay? Because again, you gotta just not just know whether you're high today or not high today, but really start testing yourself and seeing, well, what causes me to elevate? What causes me to bring it down? And so therefore do less of the stuff that brings it up, right? And do more of the stuff that brings it down. So
just basically the same time every day, or when would, is there?
Yeah, I mean, for sure that. You want to have like a sort of a standard baseline, but then I would start looking circumstantially too, right? Like again, like going back, does coffee do it? You know what I mean? Does stress do it, right? If you're feeling stressed right now, is it causing my blood pressure to go up? Well, but what kind of stress though too, right? Is it like, I had a bad day at work, does that raise it? And I just talked to somebody on the phone that, you know, made my blood pressure go up, and just started identifying what's triggering you. It's called biofeedback, right? That's a kind of technical term. Is you're getting feedback from your biology, like what is it telling you? Because then you can begin to manage it better for that. And then again, these ones again, I would say if you're not doing them, this would be another great thing to add in. And I'll tell you what, a lot of great blood pressure support supplements are really going to kind of have like a mixture of all this stuff in there, you know what I'm saying, right? So, you know, we have one, doesn't have all this, it has some other things in there too, right? Like one, it's called BP support, you know, there too, but it doesn't have like potassium in there, for example, at least to the quantity. It doesn't have the quantity of magnesium that would be needed to really hit the therapeutic levels there. It's kind of a lot of them are just a smattering of a bunch of good stuff all in one, but they're not, you know, they're not, to probably, you have to take like a big burger full of pills to do that, but so that's it. Do you guys have questions?
The taurine.
Taurine, yep.
Taurine. The wateries.
Correct.
Okay,
Has that in there.
Has that.
Yeah. Because B6 is another one that does it. Yeah. So the supplement that we use for this is called Water Ease. It's like $12, really cheap. Now it does not have this quantity of taurine in there. So this would be again like one way to evaluate. Well, maybe Water Ease helps a little bit, but you would maybe want to do some supplemental taurine a little bit on top of that. If you know that retaining water is a primary issue for your blood pressure, you would kind of give it this plus probably some extra oomph, you know, when necessary. But again, this is where it's so critical, is you got like to test. So a person might not need this much, right? It might be enough with just this to get like a nice positive effect with blood pressure. So that's why checking yourself with the BP cuff, you know, would be really just to see how your body specifically responds with all of that too. So, yep. But great question. Any other questions?
Okay, so if you have a blood pressure that goes up periodically to 155 over 86,
yep.
Is that considered high blood pressure?
Yeah, I mean, I would put that in at least the pre-hypertension category, right? Because that top number, you know, is going up above their threshold, which they kind of put at 140, right? But with that lower number being below 90, that's good, because the diastolic is what's the most concerning. If that's like over 100, then that starts becoming, you know, it's putting more stress on your arteries because it's staying. I'm not a cardiologist, I may not explain this completely properly, so the best I understand this, but you know, the systolic is kind of essentially how it pumps out, and diastolic is how it returns, right? So if it's staying high on the diastolic, it's pushing outward, and then it's not like relaxing down very much, so it's staying kind of stretched, essentially, and strained, right, if you will, on that. So that's why it's more cause for like strokes or aneurysms if that number is way over 100. And then if you're getting over 200 in systolic, you know, I mean, that's also a major cause for concern, right, too. But the answer is, the question is this: what is the best blood pressure for me? And I would say the true answer is as low as it could be, where you still feel normal or still feel good. That's what it is. I think it's different for everybody. So the answer is, it should be as low as it possibly can be, where you still feel good, meaning not lightheaded, not weak, not tired, okay? And energetic. So some people, their resting blood pressure might be 100 over 60, where you with that might feel really like lightheaded and woozy with that, but the other person might be great with that, okay? Similarly, like, you know, 140 40 over 85 or over 90, a person might feel great, you know, at that. Now, is it maybe recommended? No, but like it might not be a major cause for concern if that's what the number is, right? For that too. So, and again, it's just good to work with your doctor. And I think this is another great example and a time to bring up is that if you have a doctor that, like, you know, let's just be honest, we're not going to expect them to help you with like this kind of stuff, but if they're not even willing to kind of work with you and play around with like some dosing or like, hey, I'm going to make some changes, can you like help me with that, right? Fire them. Like, you don't have to, you're not locked into them. Find a different doctor that's going to actually help you, right? You know, with this. Because again, you don't throw the whole baby out with the bathwater in that system there too, but you can certainly fire a doctor that is not going to help you achieve your goal, which is going to be either on less medication or none at all, right? It just doesn't make any sense to have, you know, it'd be like having a financial advisor, right? And if they're not willing to help you save money or build, like, why would you have that person as your financial advisor, right? And I'm just using that example to see, like, you get to choose, right, whether that's the person you want to work with or not, right? And so if they're not who you want to work with, get rid of them, okay? Cool? All right, so I will send out this recording. I will post it, so if you want to go back and watch it and hear some of these things again. If you need help, you know, I'll do my best.